Medicare versus an employer plan. I turned 65 this year, and I am still working. I'll probably work until I'm 70. What is the rule about Medicare? I think I can utilize it even if I'm still working, but I really don't need it until I retire because I have health insurance through my job. Should I stay with my current plan or switch to Medicare?
So typically you're going to be pushed onto Medicare by your employer, at least for what's called Part A, right? So the health insurance Part A, which is only for hospitalization, will kick in when you're 65. You already paid for it, okay? And so that will become your primary insurance, and then the health insurance you have through work would be the secondary to that for things that potentially they didn't cover when it comes to hospitalization, but all your outpatient stuff, your doctor's visits, screenings, tests, all that would still be covered by your health insurance from your employer if you keep it. But here's the thing, Chip, you may not want to keep it because most group health insurance has pretty high out-of-pocket expenditures today relative to Medicare. So, and you're paying most likely through payroll deduction for some portion of the premium. Most large employers pay about 75 to 80% of the freight for the employee. Smaller employers, it's more 50-50. So depending on what you're paying per paycheck out of pocket, we'd want to calculate, let's say you're paying $150 a paycheck, 2 paychecks a month, you're paying $300 a month to have the healthcare plan you have at work. Well, did you know that a 65-year-old in Nebraska for less than $125 when they turn 65 could buy a supplemental policy called a Medigap or a Medicare supplemental policy, Plan G, the best plan you can buy, that will cover 100% of the out-of-pocket for Part A, except for a couple $100 deductible to start the year. So you would not have out-of-pocket exposure and you would not have co-pays. It would cover most of those things. Now, you would still need a Part D plan, which is a drug card, depending on what prescription drugs you take. But often when we run this analysis, something we do for you, you're better off walking away from the group plan at work and going on to full-blown Medicare. Now, it's not 100% the answer, but that's typically the case. And by the way, your employer will like this. They will incentivize you to do it because you're going to save the employer some cash. So sometimes you're going to go to the employer and say, hey, look, if I still want to work for another 5 years, but if I don't take your health care plan, right, could you give me a raise? Right? I'm just saying it's such a realistic discussion. So great question, but it's very important you get competent advice before you make a decision. In other words, don't just Google this. Sit down with a professional. We've got a specialist here that we can set up a phone or Zoom call with you if you'd like, just to get those questions answered, or you can seek somebody out in the community, but make sure they're licensed and experienced with these matters.
This reminds me, we just had one of our ABCs of Medicare classes, and we'll have another one this fall during the open enrollment period.
Yeah, we typically do it two or three times during the open enrollment period, September through like November. Please, I would highly recommend you go to that. Hey, if you're looking for more content like this, make sure you check out these videos, and don't forget to like, subscribe, and ring the bell so you'll be notified when we publish more content that will help you retire smart. Thanks for watching.